Hello, I'm Jeremy Chataway. I'm a consultant neurologist at the National Hospital for Neurology and Neurosurgery, UCLH Trust and UCL. Multiple sclerosis affects about 2.5 million people in the world and about 120,000 people in the UK, typically younger people in their 20s and 30s. It is characterised by attacks, or what we call relapses, where people can go blind, can be paralysed and have severe balance problems. We know one of the reasons for this is infection, and one of the reasons for that is problems with the bladder and how the bladder's operating or becomes dysfunctional. In this project, we'd like to have a look at the bladder and the mechanics of the bladder in more detail. And I'd like now to hand you over to Stavroula and Vanessa to discuss the engineering aspects of that.
Hello, I'm Stavroula Balabani. I work in the Department of Mechanical Engineering at UCL, and my expertise is in experimental fluid mechanics.
And I am Vanessa Diaz. I also work in mechanical engineering, but I am a mathematical modeler and I specialized in patient-specific modeling.
MS is a debilitating disease affecting many people around the world. We know this firsthand because we have close relatives suffering from this disease.
We really feel strongly about helping them, and although we cannot really tackle the neurological aspects of the disease, we think that we can make a difference using our engineering skills, and in this case it will be modeling and simulation combined with imaging, which is what this CDT is all about.
We are fluid dynamicists, and we believe that one of the key problems in MS, which is bladder dysfunction, can be modeled as a fluid structure interaction problem. That means that there is a very close coupling between the fluid, which is the urine in this case, and the structure, which is the bladder wall.
So we will use in the patient's anatomy, we'll capture images from the hospital. So we're working with Jeremy's team, which are an extremely passionate team about MS, and we will put this data into a computer. We will develop computer models to try to analyze whether or not an infection might happen.
So models are based on various assumptions, and in order to validate these models, we will build phantoms of the patient bladder, and we will use laser-based diagnostics to obtain experimental data that can be used to rigorously validate the models that will be developed in this project.
You might be wondering why mechanical engineering, and I'm going to tell you why. We are doing really world-class research. We have applied these techniques before in the cardiovascular field, and we are really passionate about trying to help patients with MS using patient-specific modeling. And we are teaming up with a world-class clinical team in UCL. UCL is an incredible research powerhouse, but the department has a lot of expertise, and we are really passionate about this project. And we're awesome, so you should come and work with us.